guys, it's Tina Sheth here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And I am a pelvic floor and orthopedic physical therapist. And today's video, I want to address to those of you, especially mainly women, who have been diagnosed with endometriosis, or if you think you might have endometriosis, and you're looking for alternative and holistic treatments on how to help the symptoms that you might be having. Now, typical symptoms that we see when patients are coming in with endometriosis is, in terms of musculoskeletal pain and dysfunction that you might be having, is everything from low back pain, hip pain, abdominal pain, urinary and bladder changes. Maybe you're having frequency, urgency, potentially even dysuria, and also pain with intercourse. So those are usually some of the musculoskeletal symptoms that can go along with endometriosis. Now, again, if you think you might have endometriosis or you've been diagnosed with it, many of you are familiar with what endometriosis is. But basically, it is growth of the uterine tissue, the uterine lining tissue outside of the uterus. And that can create, scarring and almost like a bloating type sensation in and around the abdominal cavity. And then of course it can be attributed, you can also have these musculoskeletal symptoms that I just described. So usually, you guys might be on certain types of medication, perhaps to control your hormonal balances through either birth control. Maybe you are taking other types of more invasive intervention like Depo injections and things like that. But in addition to those things, you might be having other symptoms of the endo that actually affect the musculature in and around the pelvic cavity, abdomen, hip, as well as the low back. And why does this happen with people who have endometriosis? So basically, endometriosis can create almost like an inflammatory condition. It can scar things down. And when that happens, if we look at this is a model of the pelvis, okay? If that tissue and if the organs were here, okay, and actually I have it. So these are actually the organs. If I place them back to where they are. So again, there is your bladder, here's your uterus, and back there is your rectum. If you have any of that tissue growing in and around this cavity, it can cause any type of pulling type sensation into the low back, into this area. Okay, it can cause irritation and inflammation in and around the pelvic cavity, and that can actually have an effect on the musculature in and around that's connected to the pelvis. And that can go everything into the muscles that are located into the low back, muscles that attach onto this bone called the sacrum, muscles that attach on to this part of this pelvic bone is called the ilium, any muscles that attach here, which are mainly your gluteals, and here is your hip. So this is why you might sometimes have discomfort in your hip. And then you've also got a whole set of muscles called your pelvic floor. So if I turn this pelvis back to the front, you can see that the pelvic floor muscles actually attach from the pubic bone all the way to the tailbone. And they also, two of the muscles actually have attachments to the hip, which you might be able to see here. Okay, and then there's another muscle that you can see here that's a little bit cut. And those two muscles can actually also be involved, and that's how it's related to hip issues, okay? So anytime you have any type of inflammatory process or scarring down of anything within the pelvic cavity, it can affect the musculature. But the inflammation itself, now how does that set off the muscles? Well, because your nerves that go to the organs, also many of those nerves basically form what's called crosstalk to the musculature in that area. So this heightening of kind of inflammation and irritation around the organs can actually set up a state where the muscles start to become tight and guarded. And the other thing is if you're already having pain from the endometriosis, you may not realize it, but you might be guarding and holding these muscles tight as well. So when the pelvic floor muscles are involved, if these become really tight, you can see that there's 3 holes here, okay? The urethra, which is what you pee out of. This is the vaginal canal, and then there is your rectum. You can see if all this musculature becomes tight, it's going to be hard for anything to exit as well as enter into the body. So hence why you might be having some urinary frequency, maybe even discomfort with urination, or frequency, urgency of urination. And then vaginally, pain with intercourse, anything going in or coming out. So other things that you might experience if you've been diagnosed with endometriosis but you haven't had intercourse yet, then perhaps using a tampon or having gynecologic exams can be quite uncomfortable, and those necessarily shouldn't be after the first time. And that can be uncomfortable, and that musculature can be involved. And then also constipation. So again, if these muscles are tight, these muscles actually have to relax in order for you to have a bowel movement. And if they're not relaxing, it can be uncomfortable to have a bowel movement. So this is how, when you have endometriosis, these muscles can tighten up and cause a whole host of symptoms there. Now, what can be done about this? So here at Rebalance Physical Therapy, all of us specialize in orthopedics as well as pelvic floor physical therapy. And what does that entail? Well, orthopedics basically means working around, when typical physical therapists are doing orthopedic physical therapy, most of you guys may have heard it for hip issues, low back issues, tendinitises, sports injuries, things like that. So that's kind of what general orthopedics is about. They basically treat a lot of the external musculoskeletal issues that are going on outside of the body. But a pelvic floor therapist that truly understands how to work on, a combination of orthopedics and pelvic floor will also work on these muscles, usually by working internally, vaginally and or rectally, to get these muscles to calm down. And the whole idea behind treating a lot of this is that you're trying to balance out any of the tightness and perhaps weakness that you might be experiencing in this musculature, okay? So just imagine if one side of these muscles are really tight and the other side might not be quite as tight or perhaps even weak, okay? Then that's gonna cause an imbalance in the way that these muscles are working. So they might not work as well, they might not be as strong, okay? And they might cause pain. But also, if you have tightness on one side of the hip versus the other side, then you might get changes and shifts in how this pelvis actually sits and functions as well, which is going to change the way that you use your low back, the way that you maybe use your hip, as well as another common area called your sacroiliac joint, okay, which is this joint back here, which is the back of the pelvis that actually connects this bone called the sacrum to this bone called the ilium. Okay, this is the joint right here. You can have imbalances there, and that can cause pain. So someone that understands how to balance all this musculature out, work on the muscles, something else called the fascia, which is all the tissue that binds your organs and your bones and your musculature together. It's like the glue that binds everything together, as well as understands how to work on the joints, and then understands how to give you the correct strengthening and stretching exercises. That can actually reduce quite a bit of the symptoms that you might be experiencing from a musculoskeletal standpoint as far as the endometriosis type pain. And the other thing that it can help with is something some of you might be familiar with called endo belly, which is essentially the bloating that you might be feeling due to the endometriosis. So when you balance a lot of this musculature out and you work on the fascia of the abdominals, as well as the fascia, again, which is the tissue that binds everything together in and around the organs, again, that's called visceral physical therapy, okay, where you go in and you actually work on the tissues that surround these organs too. It actually improves the blood flow, it improves the lymphatic flow, which then can help reduce endobelly or the bloating that you might be feeling, because now everything's starting to move a lot better versus feeling like it's congested in the belly. So I hope that helps some of you guys make sense as to what could be going on from a musculoskeletal standpoint and why you might be experiencing some of these symptoms, and how physical therapy, especially from a skilled orthopedic and pelvic floor physical therapist, might be able to help you get these symptoms under control. Now, obviously, if you guys live in and around the Philadelphia area, and around the surrounding, closer states as well as the region, then it's a no-brainer. Come in and see us, and we'll be able to help you with kind of improving these symptoms. However, if you don't live around this area, then you really do want to look for someone that has these types of skills. And if you Google search and you can't find someone in your area, then come over to our website. It's www.rebalancept.com. That's REBALANCEPT.com. And if you send us a contact reply and just let us know, what zip code you are in or what city you live in, then we can try and help you out and get you connected to some of our colleagues, or help you find someone that can help you. So I hope this was helpful. I hope you guys have a wonderful day. Take care.